When school's over in Kiribati, kids head for the causeway, a narrow strip of concrete bridge that provides passage for motor vehicles and doubles as a great spot to dive and swim. It's where the Pacific Ocean flows through to a lagoon in a country situated where the international dateline meets the equator. In some respects, a Pacific paradise, but closer inspection reveals something else. Kiribati is home to around 100,000 people living on 33 coral atolls, but over time around half the population has gravitated towards just one atoll, the capital, South Tarawa. It's only 30 kilometres long and 450 metres wide at its widest point. With 50,000 residents, overcrowding is a real issue. It's also been tagged as the country with the highest incidence per capita of tuberculosis in the Pacific.
We are running at about 300 per 100,000 population, which is very high compared to other Pacific Island countries.
So by WHO standards, this is epidemic proportions?
It is reaching epidemic proportion because the WHO standards or criteria says that any rates above 25 per 100,000 would be considered a public health problem. We are much higher than 25, so it's reaching an epidemic proportion.
TB is an airborne disease, generally spread through coughing. In Kiribati, a direct link has been established with overcrowded households. 75% of all cases are here in the capital, where up to 20 people live in some houses.
The average number of people per household is about 13, and that is very high. And when we talk about an households in here in Tarawa, we are talking about a normal household that is not very big. Most of them are not very big, and you can imagine how those 13 people can fit into that small place.
Which is quite different to the way it is in the outer islands, isn't it?
In the outer islands, there's a lot of space on. I mean, there are a number of houses. People live as extended families, but there are more, small housing units that they can fit into rather than in here because of land not being readily available.
Small land masses also have their advantages. On South Tarawa, a squad of health workers on motorbikes can cover the atoll in very quick time. 4 specialist nurses travel the country identifying TB cases, backed up by a team of 15 health workers who manage post-hospital home treatments. In their distinctive pink shirts, they're called the DOTS, the Direct Observation Treatment Strategies, funded by the Australian Aid Program. Daily visits allow the DOTS workers to directly observe patients taking the right dose of medication at the right time of day and locating others in need of treatment.
Because the DOTS workers or the community DOT workers are actually going out into the community, we are actually experiencing an increasing number of cases.
But the strategy is proving very successful. Infectious cases are removed from households and treated in isolation in hospital for up to 2 months before transfer to a special centre set up in a traditional building called a maniaba.
Those cases that are in the maniaba are those patients that have been admitted initially in the TB wards and then they have been tested after a 2 months period and then they are considered negative or non-infectious and then they are sent to TB maniaba.
The maniaba is usually constructed as a meeting place where decisions are made and disputes resolved. In this case, the building design serves another purpose.
There's a lot of rooms for patients to move around. It's air spaces. There's a lot of good ventilation, and that's very ideal for the prevention of the spread of TB.
Australia is also providing assistance through the construction of a new TB laboratory and pharmacy, another measure designed to help Kiribati respond to the problem and further reduce the infection rate.
From 120, 2005 to 80, 2009. That's about 30% decrease. That is the goal of this project, which is supporting the Ministry of Health goal as well.
So while numbers are still well above acceptable World Health Organization levels, they're trending downwards. Hopefully these Kiribati children can look forward to an adult life free from TB.